Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A study published in the journal Science Advances in June 2021 has strengthened the evidence that individuals who have more optimal vitamin D blood levels are less likely to become addicted to opioid drugs. With the opioid crisis we are facing today, this finding may be very meaningful. So, using data from the National Health and Nutrition Examination Survey, the data reveals that Americans that have low vitamin D blood levels that are below 50 nanomoles per liter are more inclined to use opioids and develop opioid addiction than Americans whose blood levels of vitamin D are at or above 50 nanomoles per liter. This finding remains consistent after factoring in or controlling for age, sex or gender, history of fractures, the season or the time of the year when they did the blood analysis, and the presence of chronic pain, which often drives people to use opioid drugs for pain control. Now, these findings start to make sense when you understand that exposing our skin to sunlight or tanning beds not only increases vitamin D synthesis in our skin, and thus our vitamin D blood levels go higher, but it also increases the synthesis and release of endorphins, which provide a certain level of euphoria and sort of help us feel good, or a feeling of well-being. So this is one of the reasons why many people crave the feeling of sunlight on their skin and or become mildly addicted to tanning beds. It's a bit of an endorphin rush where you just feel better, your sense of well-being is greater. Of course, too much UV light exposure causes skin aging and skin cancer. But scientists believe that humans evolved to crave sunlight because it releases endorphins, which makes us feel good, as we simultaneously synthesize vitamin D to prevent vitamin D deficiency. So vitamin D deficiency causes all kinds of problems, malformation of developing bones known as osteomalacia, as well as osteopenia and osteoporosis, and it increases the risk for cardiovascular disease, type 2 diabetes, type 1 diabetes, some cancers, and possibly other afflictions like multiple sclerosis. Thus, our ancestors who survived the primitive world were the ones who maintained more optimal vitamin D levels by getting sufficient sun exposure. As such, our bodies have an internal program that drives us to crave sunlight to make feel-good endorphins, and in doing so, we increase our survival index by also synthesizing more vitamin D. As stated by Dr. Fisher, a co-author of the study that I'm going to cite, he says, consider a surgery patient who receives morphine for pain control after the operation. If that patient is deficient in vitamin D, the euphoric effects of morphine could be exaggerated because their own endorphin levels are so low because their vitamin D is so low. And that person is more likely to become addicted to morphine and other opioids. So to bolster this argument, Dr. Fisher and fellow researchers conducted an animal experiment using mice. The study showed that mice who were made deficient in vitamin D were more prone to keep seeking the drug morphine than mice whose vitamin D levels were more normal. And when the normal levels of vitamin D were restored to the vitamin D deficient mice, their craving for morphine was also reduced and their withdrawal symptoms were much less. Dr. Fisher went on to add that while more research is needed, he believes that treating vitamin D deficiency may offer a new way to help reduce the risk of opioid addiction and bolster existing treatments for those who are presently addicted to opioids. He stated, and I quote, "Our results suggest that we may have an opportunity in the public health arena to influence the opioid epidemic." As he suggested, addressing the common problem of vitamin D deficiency with inexpensive vitamin D supplements could play a part in combating the ongoing scourge of opioid addiction. So the long and the short of this story is that achieving a blood vitamin D blood level between 50, or more ideally between 80 and 140 nanomoles per liter may be one more way to help prevent opioid addiction in your loved ones and yourself. In other words, if you have more ideal blood vitamin D levels, there's much less of a high or euphoria experience with the use of morphine and other opioids, and thus less addiction potential. As well, vitamin D supplementation should be considered as an adjunctive treatment in those undergoing withdrawal from opioid addiction, especially when vitamin D blood levels are below 50 nanomoles per liter, which is usually the case. So I've included the references for this information in the text below. Thank you for watching, and I'll see you next time.